Welcome to today's webinar. Our theme today is virtual simulation, next steps, implementation of pre-licensure nursing curriculum. Hi, my name is Dr. Liz Robison, and I have the honor of moderating today's webinar with our panelists, our esteemed panelists today. Thank you for those that are attending. I know your schedules are very busy, and thanks to our panelists for volunteering to share their expertise on this particular topic. I'd also like to thank Unbound Medicine for hosting this webinar today, as well as the partnership between Unbound and the Organization for Associate Degree Nursing for helping sponsor this platform for us to discuss this very timely topic. I'd like to briefly provide information about our panelists. I know you may have seen the bios with them. Margaret Verkuyl has been a nursing professor at Sentinel College in Canada for over 16 years and is a leader in developing and researching virtual gaming simulations. Her leadership has contributed to institutional branding for her organization, as Sentinel College is renowned for innovation related to virtual gaming simulations in nursing education. The combined work that she has done with her college and Ryerson University and George Brown College led to the development of the open access portal, virtual healthcare experience, with numerous different virtual gaming simulations. Globally, these simulations have become pervasive in nursing education with an astounding 800,000 plays in 25 countries. Margaret has over 35 publications in peer-reviewed journals, with most of them related to the science of virtual gaming simulation, as well as has authored a book chapter on the topic of virtual simulation. Our other panelist is Sarai Czap. She has 13 years teaching in the academic setting with 19 years of clinical experience in maternal child settings. She currently is the assistant department chair and nursing instructor at Austin Community College. She has utilized virtual simulation in the classroom starting a decade ago. During the pandemic, she assisted the simulation team in rolling out virtual simulation to meeting student learning outcomes, specifically at Austin Community College. Due to the success of using virtual simulations, they're going to continue with this modality. The program has also collaborated with another resource, CanSim, on developing virtual simulation games within their curriculum. Sarah is passionate about virtual simulation and what it can offer to pre-licensure nursing programs based on the positive results she has personally experienced within her own program. Again, welcome today to these panelists and sharing their ideas. I'd like to start today's session with both of our panelists providing a brief history of their involvement in virtual simulation, where their interest lies within virtual simulation, and any ongoing projects they may have in the works with this particular modality. I'd like to start off with Margaret first today. Thank you again, both of you.
Thank you, Liz. And honestly, my passion for virtual simulation started about in 2013. So I was very involved in in-person simulation, and we have about 500 students in each year of our program, our Bachelor of Science in Nursing program. And many of them had trouble getting into spots like maternal and healthcare and pediatrics. So we started creating simulations for them to be involved in. But it's very hard to get 500 students through multiple simulations, as you might imagine, and very labor intensive. And we said, wouldn't it be great if we actually did this virtually? So we started on this innovation grant, and we applied for $5,000 to be able to create one. And the agency that looked at our application said, you're going to need more than $5,000. So here's $20,000 and good luck. So this became our journey for the last number of years, and we started creating virtual gaming simulations, and you will see our virtual gaming simulations through our virtual healthcare experience to know what we did. They're not just a straight simulation. We involve gaming elements to it to actually engage the learner and get the learner really thinking about clinical decision making and what they would do next and priority setting. This has been involved with many virtual simulations, have been used this past year, especially year and a half in the pandemic. And we see ourselves continuing to use them. What our mistake was early on, and I love sharing our mistakes because that helps you not to make the same mistakes, is that when we started our first game and embedding it in our course that I taught, we studied it to see what were the outcomes, and students came to our focus groups because they wanted to actually debrief their experience. We actually thought, like many of you might have, that you can have these virtual experiences and they have rationale throughout, they have think about reflective questions and so forth. And you're thinking, what do I need to do as a professor? Let's just send them a link, get them to do the experience, and that's all we have to do. And we realized early on that's not the way you embed these in curriculum. So we started on a journey of how do you debrief these experiences? So we looked at different ways of debriefing experiences. And more recently, we're really looking at what can we actually do well in the virtual realm and what shouldn't we bother even trying to do? So our latest research, and it will be out, we'll be sending it to publishers in the next couple weeks, is looking at students' experience this past year on virtual simulation and what they learned well and what they actually transferred that knowledge to practice. So that impact on practice. And I think that's huge. And that's what we really have to think about. What can we do well in virtual simulation? What will impact a student's practice? And so we're looking at things like communication. It's an excellent way to help students learn how to communicate effectively, especially with your people with mental health problems or de-escalation and so forth. It's really good at documentation and SBAR reports. It's really good at priority setting and really critically thinking and really looking at material and determining what your priority would be for your patient, and really looking at the process of doing things. It's, as you know, not very good at haptics and being able to figure out how much pressure you apply for things, or just the whole way of doing things. And obviously, our end goal is not to graduate e-nurses, it's to graduate nurses that know how to do hands-on care for our patients. So we always need to do it in light of graduating nurses who are effective in our clinical practice.
That's a great summary. Wow. In a nutshell, the kind of that history of virtual simulation and the now, what we need to really focus on. Sarah, tell us a little bit about what you're involved in with virtual simulation, and specifically your role as a pre-licensure nurse educator.
So for myself, I started looking at virtual with ATI when they came out about 10 years ago, and actually used it in the classroom instead of doing a case study. The students really appreciated it because it was a little bit more interactive, and it actually had scenarios for them. And as a group, we would work through that. And then when I went into maternity and started teaching there, I noticed that the students were having a difficulty transitioning from the med surg to the labor and delivery. And of course, even the simulations for them were so foreign. And so I had the idea of let's use the virtual as kind of like a pre-simulation. And the students really appreciated that and said it made it less fearful going in there. They kind of had an idea of what it was going to be like, what kind of questions they would be asking, or the equipment even. So that's where I kind of see it as a really positive. And again, my students have given us really positive responses. As we go forward, and we're continuing, of course, just as Margaret was talking about having large number of students to get through simulation, we are also experiencing that. So one of the things that we're going to be doing is kind of teaming up the virtual with a high sims. So students will be either going through the virtual and debriefing with faculty and then going into high sims, or because of managing, we're going to have students do a high sims and then do a virtual. Both will be debriefed separately. We've been talking about this, so I'm kind of interested, just like Margaret, to see does it make a difference if they have it before or after, and their learning process.
That's great. And we're seeing that too in community colleges across the United States, or here in the state of Florida, we refer to them as state colleges, but really filling those gaps. And that's kind of how virtual simulation has rolled out initially. But boy, did that pandemic really push the use of this modality. And we found that many nurse educators just ran on the fly, just grabbed a virtual simulation game and just started including it in the curriculum because they had no other choice. What did you find as challenges when you first started using virtual simulation, and how did you overcome those challenges? I know, Margaret, you mentioned that you weren't initially thinking that the students wanted a debriefing that was a face-to-face, very similar to what we do in our face-to-face simulations where we have that debriefing aspect. But what are some of the other things that came out as challenges in using and incorporating virtual simulation? Let's start off with you, Sarah, initially, and then we'll go to Margaret. And I know each of you have a different perspective of your challenges within your own program.
I think the biggest challenge was technology. A lot of our students were trying to do it from home and just didn't have the bandwidth, and so they said it took them a longer time and they'd have to start over again. We actually had the students do the self debriefing at home and then come in and debrief with all of us together, which again I think really was able to hit it home again. Because some students were doing it, the day before, and some were doing it maybe 3 days before, and not wanting them to forget any of that. So again, it's repetitive too, to help them really remember the really important things out of that simulation.
Great.
And some of our challenges initially was definitely faculty buy-in. So we have a group of about 12 faculty across 3 different sites that run the same course, and we do it the same way. And for management of the course, we need to do it's a collaborative degree program. We need to do it the same way. So anytime you introduce something new, you need to have buy-in. And how we overcame the technology part is I was on the team and I said, if we decide to embed this in curriculum, we would have 560 students play it over 1 week. So if there's going to be technology problems, we would see it quickly. And so I said, I will be the technology person you can come to as a team. So they had a target person. And right away, everybody kind of relaxed, right? The technology wasn't going to be an issue because they have my cell phone and my email, and they're just going to text or email me. But then I, on the flip side, had our web designer on standby just in case there were problems. So we had this backup, and honestly, I had no emails. So it was not, and part of that is, and what we've learned in our research is really planning ahead well and showing students how to access it. And with our games, we discovered doing usability studies that if you use an Internet Explorer, the older versions of it, it descrambles the game. So right away we tell students, don't use Internet Explorer, use Firefox or Chrome or so forth. It works the best with that. And we give them some guidance technology-wise. If the videos, ours are video-based, if they start loading up slowly, then your bandwidth isn't strong enough. Maybe play it at the school where there's strong bandwidth. So we gave some guidance along with the technology in order to do that. The second thing, as Sarah mentioned, is the whole debriefing. How do you debrief these experiences? And we have a number of articles on self-debrief and combining that debriefing experience. And honestly, combining it is so, when you look at professional practice of our students, having a self-debrief really helps them learn how to be reflective practitioners for life. So giving them guidance early on, and many of our studies were done on the first-year nursing student, giving them guidance early on how to self-debrief, and then coming to that group debrief. It's fascinating. Our study showed that students that self-debrief first were more able to listen to their peers in the group debrief, because they had already thought through the experience themselves, and they've already done the whole work, and they knew what questions were going to be asked, and they knew how they did it, how they did in the self debrief from doing it. So in the group debrief, they could listen to others better, and they were more able to share their own experiences. So there was more inclusion as a result of that. The other challenge we faced was analytics. How do we use analytics? What do we do with the analytics? So for us, what we started doing is incorporating the analytics so the learner gets a summary report of everything they did in the virtual world. And so we ask them to refer to it, and we specifically say, go to your summary report as you do this self-debrief, so you can reflect on your experience and look at where your challenges were when you reflect and use these reflective questions. And again, we would get them to bring it to their group debrief, their summary report, and their self-debrief, so they could always refer to that and feel more confident in answering questions within that group debrief. So the analytics, and the last challenge was grading. We had, should we grade it? Shouldn't we? What would that look like? We had very different kind of concepts within our group of 12 faculty on whether there should be a grade or not. In the end, we decided our pedagogical approach to our virtual experiences is that they are experiential, that we don't mind if students make mistakes in the virtual world. We would actually rather them make mistakes in the virtual world than in the real world. So we didn't want them to be kind of frozen with, oh, I have to get the perfect response because this is for marks. But the flip side is we didn't want them to think it wasn't worth anything and have that, well, if my professor doesn't think it's worth anything mark-wise, then it must not be that great of a learning experience, or it must be not that valuable or that optional thing to do. So we decided to give a participation grade for anyone that did it. So everyone that did it got 1% of their final grade as a result of doing it. And honestly, all our students do it. We have found with our virtual gaming simulations that are found in the virtual healthcare experience that when I say to the class, how many of you played the game? They all raise their hand. And I know because they've sent me their summary reports. And then I say, how many of you played it more than once? And over 50% of the class will say, I played it more than once. So when you find virtual experiences that are really engaging for students and they start to really see the value in it, even if you give a very, very small participation grade, they will do it. And we've seen huge engagement levels and learning levels as a result.
That's great. And both of you have mentioned aspects of debriefing. Really how important that debriefing piece of it is. And I know with the rollout, many programs just had the students do the virtual simulation and may or may not have done anything to kind of wrap up that experience and provide that opportunity. That self-debriefing piece of it as well is important. To that reflective practitioner. We always say that in nursing, that reflective practitioner. As lifelong learners, we're always reflecting on what we're doing and how we can learn. So how do you specifically roll out debriefing? Do you use a particular framework or model? Do you give any guidance to faculty regarding the debriefing and what they should use? Margaret, let's start with you.
So because the course I'm in, we make decisions about debriefing. And I really think that when you look at theoretical frameworks within debriefing, you really have to look at what was the topic of the virtual simulation, who are your learners, how are you doing it, how are you enacting it. So for us, we have first year nursing students. So we use the 3D method of debriefing, and it really brings through the whole process of diffusing all the way to deepening and really developing those transfer to clinical practice nicely. And it's a nice guidance toward that. With debriefing, it's so important to look at theoretical frameworks. Otherwise, we might miss aspects within that debrief. I would suggest also with debriefing, especially when we're doing sensitive topics or depending how we're doing it, we really think about what comes after the debrief. Do students have an opportunity to email you for unanswered questions? Because they don't always come up in that debrief. The other suggestion for the debrief is when you debrief a virtual simulation, and if you weren't there, if you didn't facilitate the virtual simulation, students are playing it on their own, you really need to have an intimate knowledge of that virtual experience, or you will not be able to debrief it. You have to know everything that your student could have experienced, because they will all have different experiences, because they can all go down different pathways. So as educators, we need to have an in-depth knowledge of that virtual experience, but we also need to go deeper. And an example of that is in our prenatal virtual game, we dip the urine for protein. And in our virtual game, it's, what is it for? It's checking for preeclampsia. But in our debrief, suddenly it becomes, well, what is preeclampsia? And what is eclampsia, and why is it important? And when during the pregnancy are we most concerned about this, and so forth. So you get into a lot deeper. So the content is one thing, but as with in-person simulation, you can get very deep down a certain area in your debrief that you do with students.
How about you, Sarah? Any particular model that you use or you find your faculty are using with the virtual simulation products?
Yes, we started out with using more of a RAS type approach, and we were finding the debriefing kind of short and not as fulfilling for both the students and the faculty. And so we started, we are fortunate enough, we have simulation coordinators that went in and really kind of looked at the different models and looked at the research and described some different ones for us. And as a faculty, we have decided to standardize, and we're all going to be taught the debriefing for meaningful learning, which I have used during COVID with our students, and find it, I'm not talking so much and the students are really learning way more. And I think, like Margaret talked about, being able to pull out those things that maybe they didn't get just by themselves, but I feel like is important for them to know before they step into the clinical setting.
Yeah, and I think that's key with being a facilitator when you bring those students back together in that debriefing process, is really knowing how to, regardless of what theoretical framework you're using, sometimes we dip into a variety of frameworks within the whole debriefing process, and that students really provide how you're going to further develop that debriefing session, because they may surprise you. They may bring something into the session that's totally a surprise. That kind of gets into that next topic that sometimes we don't consider in the virtual simulation world. And Margaret, you briefly touched on this a little bit, is that psychological safety piece. There may be some difficult topics that come out in the virtual simulation. How do you address that up front in either the pre-briefing, the orientation of using the product? How do you maintain that psychological safety? Margaret, we'll start with you.
So one of the topics in our virtual healthcare experience is actually on suicide risk and domestic violence. So for us as faculty, I would never send that virtual game to a student to do without work beforehand. So in our course, we actually teach about domestic violence. We teach about depression and suicide risk and what to assess for. We identify and we say clearly out in the pre-brief, this does deal with very sensitive material. We identify that we have counselors that are free of charge at our institution, that if the student feels they need to talk to someone, because it could bring some of their own personal experiences into as a result of that simulation. And then we also say that we're available to talk to them if need be. So beginning even just with the content of the virtual experience, you have to think how sensitive it is. Some is procedural based and not as sensitive, and others you might have to do a bit more work up front. I think that when you talk about psychological safety with virtual simulation, there are so many facets to it. So psychological safety in your debrief, what does that look like? Many of us over the past year and a half, we've not done in-person debriefs. We've been doing virtual synchronous facilitated debriefs. And so how do you keep that safety, that psychological safety during your debrief? And I would challenge you to think about whether you insist that students actually have their camera on or not. I know we like to see students and their reaction to any question being asked or the nonverbal. We love seeing that, but maybe they're not in the greatest space. And what does their background look like? And maybe they're embarrassed on where they are at that moment. We don't know where they're living. So really, I'm going to challenge you from a psychological safety point of view, thinking about how do you even in a virtual world make it safe? We've just published an article about if you do virtual synchronous debriefs on the steps and the things to consider. There are more things such as the chat. You know, how do you use the chat in a virtual synchronous debrief? Are students allowed to chat with each other, and are they actually saying not the nicest things to each other that you don't even see? What have you controlled there? So there's many things we have to think about in the virtual world. We often in our writing say it's a safe environment. You know what? There's many things that are come out. We used to say that about in-person simulation too. We're like, in-person simulation is the safest environment there is. And then we started to realize, no, we have to really think about what safety is and how safe an environment is. And even having, you know, for us, the summary reports and the self-debriefs that students send to us, what happens with them? What do you do with them? Are you reading them? Who's reading them? You know, all those things can be elements of psychological safety for students that we need to consider. And there's a number more, but, you know, just even thinking about, is this really safe or not? Just because it's virtual doesn't mean it's safe.
Absolutely. Great. I'm looking forward to that article because it is so important and some of the things we don't think about. Sarah, how are you dealing with the psychological safety within your program?
Well, I would have to echo a lot of what Margaret is saying. Again, with any type of simulation, we've had, it's connected to the didactic. And so we've had some lecture on it, some discussions on it. And again, if it's a sensitive subject, we definitely are letting the students know to be aware of it. We do have counseling, and we do ask the students to reach out to us if there's any concerns. And she brings up a good point, and it's about the online safety, about leaving cameras on and or not. That definitely has been a discussion for us at our college, and we don't have a good, like, some faculty request it, some don't, for very different reasons. And I really encourage students to have a background so that I'm not seeing what's going on behind them. But I do agree that there's a lot of concern about that, even among students, about who else is watching, who is this being recorded, can another student be recording them? So again, I understand where there are concerns there for sure. And I think as we continue to explore this, those are challenges we're definitely going to have to address.
Absolutely. I know we are back in our college in terms of our space. And even though we were doing virtual simulations and we were having synchronous sessions, we still had some students that felt like their home wasn't a place that they could hold their classroom session. And so I offered a space within our college when we were doing things virtually that if they felt safer or less distracted coming to the college, that they could just coordinate that with me. But it really does depend on the program and what you can offer, and it's so important to consider. We haven't really talked too much about standards of best practice, but we're hearing that within your discussion: psychological safety, the facilitator, debriefing. So ANACSL, which is the International Nursing Association for Clinical Simulation and Learning, has standards of best practice for simulation. They have recently rebranded those as Healthcare Simulation Standards of Best Practice. And those standards will be updated and should be out, and there'll be open access once they're updated and out, and they should be coming out in September, we're hoping. But they have developed a new standard regarding pre-briefing as well as professional development. How do you see pre-briefing integrated into the virtual simulation piece? You talked a little bit about professional development through your discussion and what is provided to the faculty, but how does pre-briefing work in a virtual gaming simulation? Sarah, let's start out with you. How does that work in your program?
Well, actually,
yeah, you're muted. I think you're good. You were good initially. There you go.
Okay. Actually, we have our simulation coordinators have done some pre-briefing videos introducing one of our simulations that the students go through, and it actually helps them to start, and this is for level ones, how to prepare for their in-person simulation. So the person talks, and then they introduce them to the patient, so they have an idea of who this patient is, and gives them some, because we're using mannequins and not allowed to use real people or anything like that in the standardized patients. So we had them virtually so that they could introduce them and have a little bit of a conversation, so that when they came into the simulation room, they had a better idea of some of the things that were going to be happening, medications that they needed to look up beforehand, if there were any physical assessment things that they needed to see, or questions that they couldn't necessarily ask the mannequin.
Margaret, how do you integrate that standard of pre-briefing?
Yeah, and so Sarah has talked about pre-learning a fair bit, and I'm not going to touch on that. I'll touch more on the pre-briefing. I think in the pre-brief itself, there has to be a really clear expectation of what your role is and what the student's role is, because how you enact it. So are you facilitating the virtual simulation, or is the student doing it? Are they doing it on their own time? If they are, you have more information you need to give during the pre-brief than if you're actually controlling the virtual experience. If the student is, you have to talk to them about technology in the pre-brief, what kind of technology you need, how long the experience is. You have to talk about technology support, and many of the commercial products do have a 24-hour online support. Do they contact you about support? You need to talk about grading. How is this graded or not, so they understand how they can play the game. You need to talk about timelines. When are they expected to complete it? If they're completing it on their own, and how do they prove that they've done it? How do you know? What do they do once they're done? So all these things have to be in the pre-brief. So it gets fairly comprehensive. The other thing in the pre-brief is actually showcasing, like I said before, giving them an overview of how to get in. And often, even the commercial products have a little orientation, but in our study of nurse educators across North America, many times that wasn't enough. They actually either did a written kind of troubleshooting. If this happens, do this. If this happens, do this. Because what we do know is that if the student has trouble, especially with technology in the virtual experience, or they don't know how to navigate it, and so you need to talk about navigation in the pre-brief. If they have trouble doing it on their own, they're going to say the experience was not as good and not as good of a learning experience. And that's come through in many different studies and literature that's out there. So really setting the stage initially on ensuring a glitch-free as possible. I guess you can never 100% know that it's going to be glitch-free, but as glitch-free as possible experience for the student, they will rate that experience as higher, and they will learn more. It's just like us, right? We do something on our phone, we push a button or something, nothing happens, we're like, and we start getting, so we want things done glitch-free also, and they do too in their learning experience.
Yeah, and I think you both have really touched on this through your discussion, is really, it's just not giving them a scenario and a virtual game to essentially play. It's how you're really integrating that within the curriculum and starting off with that needs assessment. What is the learning objectives for that particular simulation, and how does that integrate within your curriculum? Both of you, I know, come from very large centers where you have lots of students, much more so than my little program here in Niceville, Florida. What are the challenges of really integrating virtual simulation across your curriculum? We'll start with you, Sarah.
Well, and I think that Margaret touched on what I think is always the biggest challenge anytime you're introducing anything new is getting faculty buy-in. And I will say we have been fortunate enough that we started out, our dean started out several years ago realizing that we were going to have a large amount of students and that we were running out of clinical space. And so we started our just simulation journey at that point. And as we've been going through that, several of our simulation coordinators and even myself really started getting interested in the virtual to not just have the same thing. Again, providing different modalities of learning. And so that's where, the virtual has really come in. I think, again, as Margaret pointed out, technology, glitching, bandwidth, all of that is it. And even the computers that they're using, I mean, we've had students on iPads, on Chromebooks, and they don't always work the same. And so those are, I think Margaret pointed out a very good point, is the pre-briefing is so important for these students to understand what possible complications they may have and how to navigate those. And I think as faculty, we need to remember we are the facilitators, we are the navigators, and that is on us to help with those students.
Yeah, great word, navigator. I like that word. Margaret.
Yeah, and I would start by saying when we started doing virtual simulations in 2015, we didn't have to worry about mapping it across courses or anything because we were the only one doing it. And the biggest thing we had to do is make sure our learning objectives of our virtual experience matched with the course, matched with the curriculum, because students know when you just send them a link to do something and it doesn't connect with what they're expected to do in your course. So you need to make sure those learning objectives align. I think everybody is the same as us because of the pandemic. We now are mapping our virtual experiences. And I think that's key because it used to be our in-person simulations we mapped, but they were always done in an in-person environment. And everybody knew when they were being done, and everybody knew every year what the objectives were and what scenarios the students would have. With virtual experiences, you can pull a virtual experience into your patho class. So you can have a large class doing a virtual experience. You can pull it into your clinical setting. You can use it a day that you're pulled out of clinical, right? So we suddenly have unearthed all these virtual experiences that all of us can use, not just trained simulationists in an in-person simulation unit. So, and I do want to say that the pandemic has unearthed lots of virtual simulations, but they are here to stay. They're not going anywhere. All of our programs are going to use it. So we all need to start identifying when we're using it, how many are being used, in what course, and ensure that it's done thoughtfully and strategically. Our studies and many other studies that I'm reading are saying students really appreciate virtual simulations early on in their nursing career, but as they get to their last year, they want to be in person. They're not as happy with virtual experiences. They need that hands-on experience. So, you know, we really need to thoughtfully integrate it within our system. And also with that, our studies are showing that facilitators matter. You matter. How you enact these experiences, how you present them in your course, in your whatever program you're using it in and course you're using it in, what you do and how you do it matter. And so there's more and more information about the planning, but also the faculty development that's needed to really embed these well in curriculum to really optimize the learning, because they can be amazing learning tools.
Wow, we've really touched on so many different things during this webinar. I'd like to leave the audience with some, what you would call 4 brief takeaway points. And even you probably already discussed it, but just really brief takeaway points, because just like our learners, we may want to come back and view this webinar again. I know I do, just to really be able to develop the thought process of what are some of the things that we're missing in our program? How can we best implement virtual simulation to have that positive effect on student learning outcomes? So 4 brief takeaway points, if you can, that you can give faculty that are going to use virtual simulations more, or will begin using virtual simulations. Sarah, we'll start with you.
And thank you for this opportunity. It's been great meeting both of you. My 4 biggest takeaway again is faculty buy-in, making sure that they are well versed in it, that they have viewed this, that they understand it, that they value it. Second, I think, is the pre-brief, is making sure that the students understand what it is that they're about to embark on and how they're going to do that. And then debriefing. That to me is just so important, not just doing a self-debrief, but having the students as a group debrief. And then lastly, I agree with Margaret about virtual is here to stay. We had, probably previous to this, we were kind of thinking about it, but since the pandemic, we have explored many, many different, not just the Canada ones, but the Ryerson, Swift River, all of those other products. And luckily they've been free. And so I'm very excited about it. And I think it does give us a different way for students to learn. And I think students need that.
Margaret.
And I would say we need to really get admin support, our administrators involved in this. This is not going away, as Sarah said. Our administrators need to value what virtual experiences can do for programs and start to really look at what faculty development is needed and what can be there to support you using it. We know that not everybody can go through extensive courses on it, especially if they're only doing one per year and like I said, PATHO course was my example, but we need to have that support from our administrators. Number 2 is faculty development is needed. We need faculty development so that we really embed these effectively and we optimize learning, that we don't think it's okay that a student is missing a 12-hour clinical placement, so they're going to do 12 hours of virtual simulation. How does it look? What are the hour ratios? How much time to prepare for a virtual simulation? How long in that simulation and how long to debrief it and so forth? And then I'm not going to repeat the ones Sarah said, which I totally agree with her takeaways also, but really I want you to know that you matter. You matter how you do this. And if you want students to learn and you value this and you see it as an awesome learning experience, your students will feel that. So your thoughts and reflections on the experience matter to what the students and whether they value it. When they value experience, they will more likely get more knowledge, they will be more engaged with it and do it. And really look, be creative. That's my last one. Be creative. There's lots of different virtual experiences out there. Some are boring. And your students have told you that, right? So listen to them. So be creative and then evaluate what you do so that every time we can be better at doing them. Every year we can just improve and improve on how we're embedding it, on what we're giving to students and student outcomes. So thank you very much for letting me share this and being part of this webinar.
As you can see, Margaret, Sarah, and I could probably talk about this all day, and we would develop just this great dialogue. We hope that this dialogue has stimulated some thought as you roll out virtual simulation in your program or continue virtual simulation in your program. And we thank you again for the time that you are spending with your professional development and learning more about virtual simulation, and that we have been able to tap into these great experts on using virtual simulation. Again, thank you, Margaret. Thank you, Sarah. And thank you, Unbound, for giving us the opportunity to share our passion with you today. Thank you. Guys, have a great day.